Well, good afternoon. Thanks again for joining us. I'm joined today by Assistant Commissioner Jeff McKechnie, who's the Western Region Commander for New South Wales Police, and of course Scott McLaughlin, who's CEO of the Western New South Wales Local Health District, here to provide a bit of an update and let you know where things are up to across the region. And this is developing as a regional type of problem. So, look, up until 8 o'clock last night, 36 new cases for the Health District. 23 of those are in Dubbo. There's 2 at Wellington, 5 at Parkes, 1 at Narromine, 2 at Bourke and 2 at Gilgandra, and 1 at Coonamble. So the total for the Health District is now at 320. Dubbo has 259 of those. And look, there have been quite a few people asking about the Far West as well. So I can tell you today, Wilcannia has 14 new cases. And for further specific health details, it's the Far Western Local Health District that can help you out. But we will continue to provide those numbers for you. We have also had a lot of requests asking about the infectious period that those cases are out and about in the community. I will give you a generic idea of that in a moment, but just to clarify, when people are asking for that information, it can be quite difficult to provide exact details, and unfortunately those details do change a little bit. So infectious in the community is something we rely on people telling us what they were doing. So the contact tracers who interview the people who have come up as a positive case need to provide the information to then assist in where they've been, how long they've been there for, etc., etc. If that isn't forthcoming, and unfortunately there are cases where that happens, it's very difficult and takes a lot longer to find out whether or not that person was actually infectious in the community. That investigation continues, but it's sometimes quite difficult to have all of that information accurately for you at this time each day. But I can tell you that half of the cases we're talking about have been infectious in the community. So Dubbo, Parkes, Wellington, Coonamble, Gill, Bourke, Narromine, over half are still being investigated. But the important thing, and Scott mentioned this yesterday, is that you need to regard every single one of these cases as potentially being in your community and infectious in your community. Whether or not they turn out to be or not is sort of irrelevant. There are cases almost everywhere. That's important for everyone to take note of. Testing's a bit better today, just over 8,000 tests across the region. We still are encouraging you to keep doing your bit. So keep turning up for testing, mildest of symptoms or concerns. And obviously we're updating that venue of concern list all the time. There were a lot of casual contacts in a lot of different areas yesterday afternoon and last night, and some close contacts as well. So we do need you to keep an eye on the health website. There's a link to it in this post. We're updating that literally every day. You need to be part of the solution in that. And look, part of that solution is telling the people in your life that may not hear this broadcast or pick it up on TV or radio or mainstream media or social media. If you know somebody's a regular shopper at X, Y and Z and there's a close contact or a casual contact, please tell that person. We need you to loop them in. All your family and friends, we need you to loop in on this sort of stuff. Testing clinics, all of the sites that we've had open remain open, and that's good news because we still want you to keep visiting there. The one thing to note is that the Wellington testing clinic has now moved as of today, a far more appropriate and all-weather facility, so it's moving from near the hospital, and as of 10 o'clock this morning moved to the Civic Centre at Wellington. It'll be running their Tental for 7 days a week, rain, hail or shine, so great news. You can keep coming forward and getting tested at Wellington, and that's an important one again to share with people who may not have that information. Please pass that on. Obviously the vaccination hubs are continuing as well. We've got the pop-up happening today at the Dubbo Regional Theatre and Convention Centre. That is the moved one from Pioneer Park. It's open again right now, continuing through until 4:30 this afternoon. It'll be here again tomorrow. We've just had that confirmed. The oval is extremely wet. There's been quite a bit of damage, so that will remain here at Dubbo Regional Theatre and Convention Centre again tomorrow, right through until 4:30 from 9 o'clock in the morning. That is a walk-in clinic, no appointment needed, just come along. And it's running all week, obviously. We've got that clinic running all through until next Sunday. Been fantastic. People are generally happy. People are coming prepared. If it's cold and windy and it's outside, you need a jumper. You might need some food and water as well. So do think about that when you're preparing. But there are, of course, lots of other ways to get your vaccination as well, which I'll go into and Scott will mention too. But have ID. If you have a Medicare card and you're coming, please bring that, or your individual health identification number if you've got that. If you don't, just bring some sort of ID. And of course, from today, the ADF's still in parts of our west and north. So in Warren again today, Burke today, tomorrow and Thursday. Parkes today, we've just seen Parkes is extremely busy, as some of these sites will be. Parkes has it today, Wednesday and Thursday, and Narromine Wednesday and Thursday, and that list continues. And again, there are updates on that on Facebook and the website. More details on exactly where they'll be in the post as well, so if you want to find out when it will be in your area, just check. And again, tell the people in your circle so that they're aware of it as well. On that, there's a bit of help being provided now by Live Better Community Transport in line with Transport for New South Wales. It's reached out this morning saying it's offering free transport if you need help getting to vaccination clinic in Dubbo. The number to call is 6882 7711, 6882 7711 for community transport in Dubbo. Wellington, of course, has its own vaccination clinic. We've mentioned that several times. That's run really well. It is extremely busy. The booking line for that continues to be open, but it is obviously very busy. But if you are keen to be vaccinated in Wellington, that's the way to do it at the moment, through that booking system. WAX and also Swift Street Medical and the health service down there combining. So bookings on 6845 5423, and that could end up being a walk-in, but we'll keep monitoring that for the rest of the week to see how that actually goes. And more appointments, as I mentioned, there are more appointments popping up all the time through the main vaccination clinic, which today has moved from Monera Plaza into the Woolpack Pavilion at the Dubbo Showground. That's about expanding the ability to do more and more people. So more room there, more appointments available, and that will continue. So you do need to go through the eligibility checker, or you can call on 1800 571 155 to keep booking in. There are heaps of AstraZeneca appointments available, particularly at the moment, so please think about doing that. And GPs and pharmacists also very much ramped up and ready to go. We've got lots of pharmacies right across the region that can help out. And make that choice now. Get yourself a jab in the arm as soon as you can. Shopping, we've talked about. Keep planning around that. We're supporting supermarkets who have had some real problems with staffing. There are some solutions in place to help that. Plan ahead if you can. If you don't need to go to the shops or don't want to, click and collect or the delivery. But of course, they're very stretched at the moment as well. If you're going to the shops, try and make it just the one person from the household. But if you need children with you, obviously, or a support person, just do it sensibly. Got a shout out today to Lifeline on 13 11 14, 24/7 support right across Australia and including our region. They've been taking over 3,500 calls a day, up from 2,200 a day about 18 months ago. That's the significant increase that we've seen. And I particularly want to highlight the fantastic team that we've got at Lifeline Central West. We've got over 100 staff and volunteers that are based in Dubbo, Orange and Bathurst, and they are doing some really heavy lifting at the moment. They're working over 20 hours a day. They've done extra shifts to make sure that there's someone local in our region taking those really important calls. So I really want to give a big shout out to all the crew at Lifeline Central West and Lifeline right across the region. You're doing an amazing job. You're the thumbs up for today. Well done. And if you want to give somebody a shout out, just get in touch. We'd love to recognise the people that are making a difference and doing some really good things across our community. Now, there is again a lot of information. Scott will have some more information. We will have links to that, as much detail as we can in this post or on other posts. And of course, the New South Wales Health website is a great place to go. Check all those venues of concern every single day. So if you can, look for the answers before you reach out. We are all very, very swamped at the moment. We're trying to get back to you as soon as possible, but your help in this really helps us as well. Keep up the love, the support for each other, and I'll hand over to Scott now for his detail. Thank you.
Good day, everybody. Thanks, Dougal, for that update. So we know this Delta strain continues to ravage across Western New South Wales. I know it's a really scary and concerning time for everyone across the region. Can I please urge everyone to please look after yourselves and your families in this time. We know that the virus transmits between people. We know that there's a lot of ways we can provide support and care and love to each other. I know it's going to be some difficult times in front of us. Please, everyone, take care and think about how we can support each other through this. It's on the back of another very concerning day with 36 new cases to 8 p.m. last night, and one additional case overnight that I want to flag in Bathurst. We're still seeing the vast majority of those cases infectious in the community, and some of those for beyond 2 to 3 days. So the locations of the new cases to 8 p.m. last night, Dubbo 23, Parkes 5, Burke 2, Gilgandra 2, Wellington 2, Coonamble and Narromine 1. We had 22 out of those 36 cases were infectious in the community, and some of those for quite a significant amount of time. We've still got 7 that are under investigation. So from that, we need to assume that in all of our communities, there are people infectious. Our testing, our series surveillance and other things will help us find those over time, but please, there is some real urgency to getting in front of this. The case overnight in Bathurst, we know was infectious in the community for some time, and so I'm pleased going to put a call out to the community of Bathurst that is really crucial. Come forward and get tested. We saw a decrease yesterday in the testing numbers from the day before, and so I'll provide some further update on that in a minute. We've still got 45% of our cases are aged under 20, 90% of those aged under 50, and a growing number so we've got 4 aged over 70. Our elderly people and people with our real chronic illnesses are our absolute priority to protect and support through all of this. We know that they've got a high rate of hospitalisation and intensive care needs. But we've now got over 100 venues of concern. Can I please ask everyone to continue to look at those? There's more coming on every day of the week. We've expanded our contact tracing team and our public health capability in the last couple of days, and so please keep an eye on those. There's no new sewage tests that have come back with COVID fragments in the last 24 hours. There's a lot being taken today and yesterday, and so we do expect further surveillance on those to come back in coming days. The testing, we saw 8,200 tests over the last 24 hours, so that was an increase of about 2,000 on the day before. So I can say a huge thank you, and particularly in Dubbo, to the nearly 3,700 people that came to get tested in the last 24 hours. Mudgee saw 411, Bathurst 667. I'm really concerned about how low that is for the size of Bathurst. Orange 1,400. Parkes a huge increase, and with the new cases identified yesterday of 515. Wellington 156. Burke again worryingly low at 53 people. And so can I please highlight a couple of those locations where we know we've had people infectious in the community and really need people to come forward and get tested, particularly in Burke and Bathurst. Our testing facilities will remain open throughout the whole of this week. Can I just highlight one in particular that we're keen to see people come and get tested at is in Gadooga. Our health clinic is available, and if you call ahead and notify the clinic ahead of time, that's open 9 a.m. to 4 p.m. and so please can I ask everyone to come forward in Gadooga. Our healthcare workers, we've now got 156 staff in isolation. Of those, 21 workplace exposures of staff needing to isolate for a full 14 days. Now that's an increase of over the last couple of days in the number of staff that we've got off and furloughed for some time. We now have 13 patients in hospital, 4 of those in intensive care and 1 patient ventilated. We know that this virus is having a terrible effect on people's bodies that are needing ventilation and intensive care support, and please everyone, this is the most vulnerable, crucial people in our community that we have to support, and please stopping and slowing down the rate of COVID in our region. We now have 321 patients in our care in the community programs right across the whole of Western New South Wales. We've got specialist clinicians that are going into the home to support patients with either COVID or other chronic health conditions. In the last 48 hours, we've actually seen around 20 people that have been discharged from that program or have now recovered from their COVID condition. And so there's some positive signs that we are starting to see people recover and they're no longer active in their COVID infection. A couple of hospital changes to flag. We've done a lot of work in Burke Multipurpose Service that enables us to now care for patients with COVID in Burke Hospital. We've done a lot to protect the aged residents in Burke Multipurpose Service, and so that's a significant addition to our ability to look after people that do need some form of hospitalisation. Clearly, if we do need to move people to intensive care support. That'll be down to Dubbo and the region. Our vaccination hubs continue to expand, and significant improvements in the last couple of days. The ADF has continued to shift across the whole of Western New South Wales, out in Bourke today, in Parkes and a lot of other communities. That's a really valuable opportunity for people to please look at the information available on when those walk-up clinics are available with no booking that's needed. Our vaccination hubs in Dubbo, Orange and Bathurst are now available 12 hours a day, 7 days a week. Can I flag that AstraZeneca is an extremely available, high quality and safe vaccine. In the last 24 hours we've seen some research come out of the UK that says that over a 30, 60 and 90 day period, AstraZeneca is actually more effective than the vast majority of the other vaccines with Delta strain. And so can I ask everyone to really consider AstraZeneca as a safe and effective option. It's available immediately. Our vaccination hubs have a lot of appointments available tomorrow, and so please, everyone, look for those opportunities on the vaccination eligibility checker, and you can book in for that in pretty quick time frame, not just with the vaccination hubs, but also the GPs, Aboriginal Medical Services, respiratory clinics, and other vaccination points around the region. So I'll pause there and hand over to Jeff McKechnie.
Thank you, Scott. Good afternoon, everybody. When you hear those numbers Scott's talking about, so many staff from his organisation currently unavailable, I think it's appropriate that we always keep in mind the great work being done by our health workers and other workers right across regional New South Wales, coming in contact with this virus on a daily basis, and getting their tests and then turning up back at work to do it all again. So it's an incredible effort, and hats off to those folks, and I hope they're all okay. From a policing perspective today, overnight we issued around 130 infringement notices across the whole of Western region. Here in Dubbo, around 30, so down from the last couple of days, which is pleasing. It was raining quite heavily last night as well. That may have impacted on people's activities, but again, 30 people still not doing the right thing in terms of the current health orders, remains not good enough. We just have to be so serious about this at the moment and stay home, stay put, stay where you are. If you're staying with someone in their house and you've been there, stay there. Please don't be out and about. Travelling, not just around Dubbo, we're still getting people travelling across the region, and our small communities are so vulnerable at present, particularly from people in Dubbo, where COVID is so widespread at the moment. So please resist the urge to travel to Brewarrina, to travel to Gaduga. We just can't do that at the moment. Put other arrangements in place. Whatever the problem is you're trying to fix, try to come up with another solution other than actually travelling to those areas, because you're putting those small communities at risk. We're still having our issues with people coming out of Sydney, coming into the central western part of our region. If it's not absolutely necessary to get work done on whatever it is, please discourage it. Don't bring tradesmen in to our region from other locations unless you absolutely have to. Things like that are really having an impact on us. So please, I just implore people at the moment to lift, I guess, to another level around reducing movement, lift to another level around keeping our communities safe by limiting access from those areas, and then from Dubbo into those other areas as well. Our emergency management arrangements are in place and working really effectively. All of our local emergency management committees are meeting regularly, addressing those local issues where they are on the ground across all of our LGAs. All of our council areas are being covered at the moment, and those people from all agencies, councils, are doing a fantastic job trying to keep their communities safe, however big or small they are. Our ADF teams are working closely with police here in Dubbo Burke and Wilcannia. They're on the ground today as we speak out there, working with our police, looking after the well-being of those communities. Our ADF vaccination teams, our vaccination hubs, as we've heard, are up and running and really well patronised. Please, one of the reasons you can be out of your house at the moment is to get a vaccination. Go and get one. Scott outlined all the options in the world. Please go and get a vaccination at the moment. Get yourself out of the house for a couple of hours. Stretch your legs. I know you're standing in a line, but you know that's just the way it is at present. Our teams are in Wilcannia today, going door to door in Wilcannia, asking anybody who wants a vaccination to come forward and have it, and we'll be supplying that service, you know, for the next few days in Wilcannia to make sure everybody who needs or wants a vaccination can get one. And that goes for all those other locations we're attending. Those hubs will be set up, transport arrangements are in place, we're working with councils, we're working with other agencies to be able to get you to those vaccination hubs to get that jab if you so desire. So please take this great opportunity and get yourself vaccinated. Thank you. I'm happy to answer any policing related questions from anyone online.
Thanks, Jeff. If anyone on the call has questions specific for Jeff, could they raise their little digital hand? Looks like we've got one there from Riley Krause from the Central Western Daily.
Yeah, hey, so there was an incident this morning at the 7-Eleven here in Orange and Bowling Road. Police said they're aware of it, but they've also said it's a health matter. So there's just a bit of confusion about who's sort of in charge and what the scenario is. Just hoping to get sort of information on what happened there.
The police are in charge, Riley. We're aware of the incident. We're working with health to take steps to make sure that all the appropriate safeguards are in place around that location and around an individual that was there. But that'll play out over the next few hours and days. But you know, I'd reassure the community down there, don't worry too much about it. You know, we've got the situation in hand, and things roll on in Orange.
Okay, no worries. So are you able to, just able to say, like, is this a person like who's like from Sydney saying you're breaking the law or anything like that, or?
No, not at this stage, mate. It's a situation that's developed out of the pandemic response, and we're just making sure that everyone's okay and people are getting the appropriate assistance they need.
If you don't mind, can I just jump in on that one as well? It's Claudia from Prime here. We heard that they had Queensland number plates. Are you worried that somebody's crossed into the state from another state that shouldn't be here?
No, look, really, that situation is in hand. There's a lot of private and health information involved in that. But again, I reassure the community, don't worry about it. The police have got it in hand, and yeah, we'll work with health to sort out any further action that's required on it.
Can I ask, what are the biggest compliance issues that you're seeing? This is Robin from ABC.
Oh, g'day, Robin. Look, it's just that movement. It's just that people not being where they need to be, particularly at night, obviously, not staying put, being out of their houses for, you know, any number of reasons that we hear. And at the moment, there's only those 4 reasons you can be away from your premises. We're also seeing some small breaches by people who are actually under, you know, who actually have COVID or are very close contacts of people with COVID and are awaiting results. So again, it's just that non-compliance with actually staying home that's probably concerning us the most.
Cool. Thanks, Robin.
No one else?
I can see that Oliver, you have your hand raised. If you want to go ahead, mate. Oliver from the Coonamble Times. Oliver might be having tech issues, so we'll move on if no one else has any questions for Jeff. We'll bring Dougal back out.
Okay.
And I'll ask if anyone who has
Thank you. Cheers.
questions specific to Dougal could raise their little digital hands now as well. Or alternatively speak up if you have questions for Dougal. Hamish?
Dougal. I was just wondering if you've considered keeping the walk-in vaccination hub at the Regional Theatre and Convention Centre, seeing it does cater for both the wet weather and dry conditions, and especially seeing it being such a huge success.
Yeah, look, it certainly will be there again tomorrow. It's being looked at as to how effective it has been. It certainly has been working really well and does provide that all-weather solution. But look, the park was also a really good solution and encouraged people that maybe didn't have transport in that part of West Dubbo to be able to walk there. So the park is definitely on the agenda at some point. At the moment, we're dealing with a bit of wet weather, and obviously the weather overnight has meant that there's a bit of damage and there's quite a bit of build-up of water. So probably going back to there tomorrow, even maybe the next day. We're looking at that on a day-by-day scenario. But certainly here at the Dubbo Regional Theatre and Convention Centre, it's been working extremely well. I think everyone has got through in a couple of hours. It's a great setup. It's really a credit to the team, and a big thank you to Dubbo Regional Council for making that facility available. It's working really well.
Dougal, it's Lee O'Connor here from the Coonamble Times. Just wondering if you can clarify whether the case that's listed for Coonamble is actually in Glardenbone or Coonamble?
Look, I might leave that to Scott. We have been referring to Coonamble Shire, but obviously well aware that people are also aware of Glardenbone, but I might leave that to Scott Lee. It's one of those things that health is deciding how that will be referred to.
Good, thanks.
Thanks, Lee. Robin, you have a question for Dougal?
Yeah, just given how popular the vaccination clinic is, and we were told it was going to be for about a week, is there plans to maybe extend that beyond this week?
Look, the pop-up clinic at the moment is set through until Sunday, the 29th. So, look, lots of things are happening in the background as far as what other solutions there will be. That will be discussed as one of them, and also better availability for those that are making bookings. That's why the Monera Plaza clinic moved to the Woolpack Pavilion at the showground. It can take far more bookings and get far more people through. It's running 12 hours a day now. As Scott said, the Oxford University vaccine, AstraZeneca, there are plenty of appointments available for that. It's the one that I've had. It's the one that we're encouraging people. You don't need to wait for Pfizer unless you do. If you do, that's fine. If you don't, get the AstraZeneca while there's plenty available. Bookings available for tomorrow. But look, we will be looking at all of the options to make sure we can keep the excitement and the anticipation around getting a vaccine going. We don't want to suddenly have a hard end to this. We want it to roll on.
Thanks, Robin. Does anyone else have any questions specific for Dougal?
Happy days.
Thanks, Dougal. We'll move on and we'll bring Scott back forward.
All good, mate.
Sorry, Cam and Maggie, were your questions specific for Dougal?
Scott, sorry, from me.
Okay, yeah. Yep, that's all right. We'll roll through everyone one by one now. Hamish from Prime and Dubbo, did you have anything for Scott?
Yes, I did. The Monera Plaza walking clinic today, obviously, it's a bit damp outside, but there was barely anyone there. Is that a concern for you and authorities, especially as case numbers really haven't deviated?
Thanks, mate. Listen, we know that with the wet weather it's been difficult for some people to get out. I know the drive-through testing at the showground has got a lot of people there today. The turnaround times are still pretty quick, and so I really would encourage everyone, please come out for testing today. It is a crucial time for us in all the communities right across Western New South Wales, and including Dubbo. With the growing case numbers, a lot of people infectious in the community, and so please, there's some real urgency to come out and get tested if you've got any signs and symptoms, however mild.
Hamish, anything else?
And I suppose with the growing cases, are you guys still feeling like you're on top of things, or is it getting out of control?
Well, I've got to say it's getting to a very concerning level where we know that the growing numbers of cases infectious in the community means the potential further spread of this virus across the whole of Western New South Wales. We know no one's immune to this. We know no community, no household is immune to this. It's going to be a crucial time in the coming days, so everyone please stay at home. Stop moving around as much as you are. You've heard Jeff talk about the number of infringements that are being issued across the region. We know that when people pick up COVID, within the first 5 to 7 days, they start to get really crook, particularly if they're old. We're seeing more older people picking up the virus, and that's the last thing we want to see in any of our communities. So can I please implore people, stay at home, stop moving around, don't have contact with anyone you don't need to. Please stay at home as much as possible.
Thanks, Scott. Thanks, Hamish. Robin from ABC Western Plains. Do you have anything for Scott?
Yeah, you mentioned that you've got still quite a few health staff isolating. How is that affecting care across the region? What's the pressure on health resources at the moment?
So with the increasing number of staff that have needed to isolate because they've been in contact with a confirmed case or they're a casual contact, that is starting to put some real pressure on our staff and our services. We are reaching out for additional staff, and so we'll have information available in the next 24 hours if people are interested or are able to come and help. We will need extra support in coming weeks. We know that as further locations have cases of COVID-19 and potential for impacting on our precious health staff, then we will need some extra help.
Robin, one more if you've got anything more.
Yeah, sorry, it just flew out of my head. I did have a question. We went out 14 days into this since the first case was found in the region. Are you hopeful that if isolating and following these orders for 14 days that we're going to start to see those numbers decreasing?
Yes, we're starting to see a number of people that have come through their COVID infection and are now non-infectious and don't have COVID at the moment. So we've seen in the last 2 days about 20 people are now healed, in essence, from COVID. And so there's some good signs there. We know that there's been a lot of young people infected very early, and particularly in Dubbo. They don't typically get as crook as a lot of the older generation. So there's some pleasing signs there. The active cases aren't growing as quickly as they have in previous days, purely because the numbers of people that have become uninfectious, non-infectious from COVID.
Thanks, Scott. Thanks, Robin. Sorry, my network just dropped out for 5 seconds then, so I assume we can move on now to Ryan Young from the Dubbo News.
Thanks, Matt. Scott, I was just wondering if you had some details about the vaccination status of the 5 patients in ICU. Do you know whether they were unvaccinated or if they've had any doses at all?
So I don't have the details with me for those patients. We'll be following that up in coming days. We know that vaccination is one of the best protectors for people stopping having to go to an intensive care and being ventilated. And so I really would urge everyone, and particularly focused on AstraZeneca opportunities in coming days.
Thanks. And just a follow-up on the announcement about Narromine Hospital being a COVID hospital yesterday. A lot of people in the community have responded negatively to that, and they say they're worried about having those patients in the community. Are you able to just provide some advice on how it'll be safely run, or let us know when there'll be further details about how that will work?
Sure. Well, like any hospital, we've got extreme safety things in place for both our staff and patients and the broader community, and so people shouldn't be concerned about the role that Narromine and other hospitals across the region might need to play for patients with COVID that need hospitalisation. This is our time to look after the whole of our community and our region, and so I really would reassure everyone this is a sensible and logical thing for us to do. We do want to care for people as close to home as possible.
Thank you.
Thanks, Ryan. Claudia from Prime 7.
Hi, Scott. How are you?
Hey, Claudia.
I'm just wondering whether you can talk us through the Bathurst case overnight, and the new exposure sites, whether this person has contracted it from somebody in the region, and how concerned are you, I guess, in regards to spread?
Sure. So the Bathurst case that was identified overnight, we know has been infectious in the community. We don't have a known link yet to to where they might have picked up COVID from, and so we're incredibly concerned that there's been a lot of patients, people in the community in Bathurst that have been infectious in the community for more than 2 or 3 days. And so can I please urge everyone in Bathurst, today, now's the time to come and get tested. If you've got any signs and symptoms, however mild, there's some real urgency to this. We know that COVID is crawling around Bathurst and all of our communities, and so please come and get tested if you've got any signs and symptoms.
And then in regards to Orange, we know 6 cases were sort of like a cluster in isolation. There's one other case, 7, but none since. Do you think we're in the clear, or is it sort of the time to be on alert? Are you expecting more to come?
Guys, and far from. We know the vast majority of the cases in Orange were infectious in the community, and so this is really time for everyone to be super cautious and aware that if you've got any signs and symptoms, however mild, it could be you, it could be your neighbour, it could be one of your kids. Please come forward and get tested. Orange, Bathurst, Dubbo, Parkes, Forbes, anywhere across the region. We know that this virus can go anywhere. It doesn't have any boundaries. And so please don't think that your community or you are immune to it at the moment. Please come forward and get tested if you've got any signs and symptoms.
Thanks, Claudia. Let's move on to Lee from Coonamble Times.
Hi, Scott. Just wanting to clarify about the case that's been reported as Galargamone and then as Coonamble. Is it just the one case, and also has it been infectious in the community, and if so, which community?
Sure, Lee. So we've now got 3 cases in total in the Coonamble local government area. The case that was identified yesterday is living in the surrounds of Coonamble Township, and so I really would urge everyone across the whole of the Coonamble LGA, please. We know that people have been infectious in your communities. Please come forward and get tested as soon as you can.
Okay, thank you.
Thanks, Lee. Maggie from the Parkes Phoenix.
Hi, Scott. Just want to know the 5 people in Parkes who tested positive yesterday. I believe they're all in one family. Would you be able to give more details whether they were out in the community?
Thanks, Maggie. We know a number of the people in Parkes that have been confirmed COVID cases were infectious in the community, that they are all in isolation and part of a family, and so we're providing a lot of support, both clinical and other support into that family. But please, everyone in Parkes, this is a real time to be super cautious. If you've got any signs and symptoms, however mild, then please come forward and get tested. It was really pleasing to see the significant number of people that came out to get tested yesterday. Please come again if you've got any signs and symptoms that come on in the next couple of days.
And then my other question, it's the first day of the pop-up clinic at Parkes, and there's been a massive response despite the cold weather. And after 2 hours, people have already been turned away because they've reached the quota. Can you tell me how many people are they able to do per day?
We expect around a couple of hundred people in Parkes today to be vaccinated. We know that there's a big demand and an interest in getting vaccinated. So I can say thank you to everyone for seeking out that opportunity. I'm sorry we won't be able to see absolutely everyone that's lined up, and some people have needed to be turned around. But there are a lot of opportunities for vaccination across all of our communities, between the GPs, Aboriginal Medical Services, the vaccination clinics, the respiratory clinics. Please look at the vaccination eligibility checker. It's being updated every day with new vaccination opportunities, and particularly for AstraZeneca. AstraZeneca is widely available across all of our vaccination services. We've got appointments available tomorrow in a lot of our hubs. We know that GPs and pharmacists in particular have got availability of AstraZeneca, and so please look for those opportunities. If you can't get into one of the ADF drive-up or walk-in clinics, then please don't stop there. Keep looking and take those steps to get vaccinated as quickly as possible.
Thanks, Maggie. Bradley from the Western Advocate.
Thanks, guys. I just want to ask about a
few questions about Bathurst. In regards to the suburb of Kelso, we had a number of venues of concern come out yesterday. A lot of them were in Kelso. We've got the new testing clinic in Kelso. Is Kelso a particular concern in Bathurst?
Yes, we do have a number of the cases that reside in Kelso in Bathurst. Quite a few, if not most of those, were infectious in the community for more than a couple of days. And so I really would urge everyone, come and get tested. There's a new testing clinic in Kelso today. Don't delay. There's some real urgency for us getting in front of COVID, and particularly in Bathurst.
And just another question. The cases that we've had in Bathurst, I think we're up to 7 now. Has there been any link towards that funeral in Wilcannia at all?
There's still a number of the cases in Bathurst. We're trying to track down the links. We know across the whole of Western New South Wales there's quite a few of the cases that were at the funeral in Wilcannia. Can I please ask everyone, if you were at that funeral, then please come and get tested. Don't wait for any signs or symptoms to come on. Please, there's some real urgency. It was a major spreading event. We know that there's growing numbers of people that were at the funeral that are becoming infectious and having COVID confirmed, so please don't hesitate.
Thank you.
Thanks, Brad. Joanna from ABC Central West.
Thank you. You did mention, I was going to ask about the known sources, if you know where the infections have arisen from in Bathurst and Parks. Have you been able to identify where it's originated in Parks, and could smaller hospitals like Parks be used the same way as Narromine is being done?
Sure. So we've still got about 20% of our total cases that have not found a definite link to where they picked up the infection. Now, our contact tracing teams and our detectives are working feverishly on trying to track that down. It'll continue to be one of those mysteries for us in some communities, but what that means is that there's still someone infectious in the community if we haven't been able to pick up the link. And so there's some real urgency to people coming forward and getting tested. That's certainly the case in Parks. And so please, I really want to urge some attention to coming and getting tested in Parks. It's really critical. We are looking at how we adapt a number of our hospitals to care for COVID patients right across the whole of Western New South Wales. That's not going to be every hospital. We've got a lot of multi-purpose services. We've got aged residents in some of those facilities, and so they're going to be our crucial priority to protect and support through this. We do see a need for the likes of Parks Hospital to be able to care for patients with COVID in the future. We've still got some work to do looking at air conditioning systems and other things in the facility that we'll need to just tidy up and make sure that it can play that role.
Thank you. And my other question is with regards to the lockdown itself. So John Barilaro said yesterday that a decision would potentially be made or announced tomorrow, Wednesday. Given the fact that the cases are still trickling on out here, what's the likelihood in your mind that the lockdown will be extended for the Western region beyond a week and even more?
Well, we're still seeing 25 to 30 to up to 40 cases a day being identified, and today the vast majority of those were infectious in the community, and so now's a really crucial time for us. The stay-at-home orders are just so important to stop the spread of COVID across the whole of our region. Now, I know in Dubbo and some of the parts of Western New South Wales, we've still got too many people moving around. It's just going to be crucial in coming days. Please, everyone, stop the contact that you're having with other people. We've got to assume that the person next to you in the lineup at Woolies, in the service station, your kids playing outside with the neighbours' kids, that could be the point that your family picks up COVID, but you also could be the person that spreads it to somewhere else. And so I know the lockdown and the stay-at-home orders are difficult for everyone. Please, now is a crucial time with us. I know the decision will be taken in the next 24, 48 hours around any extension to that. We've got a window of time right now to stop it dead, and so please, everyone, stay at home as much as possible.
Thank you.
Thanks, Joanna. Riley from the Central Western Daily.
There you go. So just similar to the questions asked before, do we have a known source of infection for that 7th Orange case, the one that wasn't one of the workers from Sydney yet?
We don't have a source of infection for the 7th case in Orange, and so that tells us that it could be one of the other 6 cases, or there could be someone else in the community with that's infectious at the moment and further spreading COVID. So please, in Orange, come and get tested if you've got any signs and symptoms.
Okay, cheers. And the other one's to do with testing numbers. I was wondering if we were able to get a number of people who have been identified as either close contacts or casual contacts since these 7 cases were identified, and sort of in that, are we seeing good numbers of people get tested who haven't been identified?
So I don't have those figures with me, but we do know that there's a lot of people in isolation that are close contacts or casual contacts right across the whole of Western New South Wales. The steps that our public health team take to make sure that we can identify those people as quickly as possible, get them into isolation, get them tested, and particularly for the close contacts throughout the whole of the 14-day period that they're required to stay at home is just a crucial step for us.
Cheers.
Thanks, Rod. Cam, Fairfax Media.
Hello, thank you. Sorry if this was addressed earlier, but my internet connection was a bit sketchy before the questions started. In terms of these cases that we've seen today in your health region, how many of them are in Aboriginal people? And in terms of the overall total of the cluster so far, are we still seeing it primarily affect Aboriginal people?
Sure. So we do have a large number of Aboriginal people that have both been confirmed with COVID and also close contacts. Around 65% of our total number of cases in the region at the moment are Aboriginal people. And so I really would say to community, please, this is time to stay safe. Please look after each other, but do it in a different way. We need to stop the spread of COVID across the whole of our region, but particularly for our Aboriginal community. Please, it's time to take care of each other, do it in a different way. This isn't time to go and visit auntie or uncle. It's not time to go and play around outside with your neighbour and other kids. Please, everyone, stay at home. Please look after yourselves and your community and do things in a different way.
Thank you.
Thanks, Cam. Lee from Campbell Times, I noticed your hand just went up. We've got time for one more if you've got one more. Perhaps not, that hand might have been up previously. So that is everyone. Thanks guys for attending. I'll get the recording out as soon as we can.
Thanks everyone. Stay safe.